Welcome to this video which gives an overview of the Public Health Outcomes Framework. The Public Health Outcomes Framework was first published by the Department of Health in 2012, setting out a framework of public health indicators that help us understand how well the nation's health is being improved and protected, and the inequalities within England. The framework focuses on the two high-level outcomes that are aimed to be achieved across the public health system and beyond. These two outcomes are increased healthy life expectancy and reduced differences in life expectancy and healthy life expectancy between communities. These outcomes reflect a focus not only on how long we live, our life expectancy, but on how well we live, our healthy life expectancy, at all stages of the life course. While we will be able to provide information on the performance against both these outcomes, the nature of public health is such that improvements in these outcomes will take years, sometimes even decades, to see marked change. So we have developed a set of supporting public health indicators that help focus our understanding of how well we are doing year by year, nationally and locally, on those things that matter most to public health, which we know will help improve the outcomes stated above. These indicators are grouped into 4 domains. They are improving the wider determinants of health, health improvement, health protection, and healthcare public health and preventing premature mortality. Indicators have been included that cover the full spectrum of what we understand public health to be and what we can realistically measure at the moment. The indicators are reviewed every 3 years following consultation, and the current set covers 2016 to 2019. Each indicator can contain a number of sub-indicators, taking the total number of indicators and sub-indicators currently in the Public Health Outcomes Framework to 159. Indicator data is published on a quarterly cycle, with updates in February, May, August and November. Details of the regular updates can be found on the gov.uk pages, along with the full policy documentation. The data for the indicators in the framework are all presented through Public Health England's Fingertips tool, which allows many ways of visualising the data through the selections that you make. This video will summarise the main views of data that you can obtain. PHE also has a more detailed video explaining full details of how to use the tool. From the home page, the easiest way to access the data is by clicking the Start button, or to go to a specific domain, click on the domain's name. Options further down the page include a search by area name or by postcode, details of recent updates, and links to the policy pages. At the top of the page are links to further information, frequently asked questions, and technical guidance. You can also contact the team in Public Health England who produce the tool through the link at the top. At the top of each page in the tool are options to select the display that you want. Firstly, the domain can be selected. Secondly, you can choose the type of visualization you wish to see. And finally, the area details and benchmark for comparison can be chosen. It is also possible here to choose to view data for the SIPFA nearest neighbours to the selected local authority. Below this will be the selected visualisation. Here we have the overarching indicators for upper tier local authorities in the East Midlands region, with the value for each cell coloured red, amber or green, depending on whether it is statistically worse, similar or better than the value for the benchmark. In this case, the England value. Options above the table enable the choice of displaying trends, as well as the values themselves. In another view, we can see an indicator displayed in a trend chart. It is possible to change the indicator and the area in the drop-downs to view other charts. The benchmark, displayed as the black line in the chart, can also be changed. The Compare Areas view displays a bar chart, and with this view there is also the option above the chart to choose a chart for all areas within England. The Area Profiles view displays the familiar spine chart for the selected area. Other views allow the data to be shown in the form of scatter plots using the Compare Indicators view and in the form of a map. There are also specific views for inequalities data where available, for England only, and showing the spread of indicator data in the form of box plots. The population view shows the age structure of the selected area's population, and further contextual information is given in the Supporting Indicators tab, alongside the framework domains. Full definitions of all our indicators, including the rationale for inclusion in the framework, can be found in the Definitions tab. A lot of users like to use the contents of the tool within their own reports. There are a number of ways of doing this. For example, all the charts can be exported as images from the relevant pages. Data and metadata can be downloaded in CSV files from the Download tab. Fingertips also has an API feed and a package developed in R to allow data to be sourced directly. For more details on this, please contact the team via the Contact Us option at the top of the web tool. Reports are also available from the Download tab in PDF form. Alongside this, we also do some national reporting. This reporting includes a statistical commentary around each release at national level, which can be downloaded from the gov.uk release pages, along with a summary document for England showing all indicators at a glance. Local authority versions of these have also been developed and can be obtained by contacting your local Knowledge and Intelligence Service within PHE. We've also published blogs about our recent releases. Thank you for listening to this video. Here are the links that were mentioned earlier, along with QR codes to allow you to access them directly on your phone or tablet. If you have any inquiries, please ask one of our Knowledge and Intelligence Service colleagues, or send us an email to phof.enquiries@phe.gov.uk.